Hello everyone. So today in this video I wanted to run through a means of assessing and improving your shoulder mobility and health. So for this I'm actually going to demonstrate how we are going to assess rotation of the shoulder joint. So the ability of the shoulder to be able to internally rotate as well as externally rotate. Alright, the reason we're going to be exploring this is because this is the fundamental motion for the shoulder joint, and it can be very indicative of many other things. So how well you're able to rotate that shoulder, or even how well you're not able to rotate the shoulder, may be indicative of things such as loss of function, pain, so you could be experiencing or on the way to experiencing things like impingement, weakness with certain movements, a pinching sensation at the joint, tightness, difficulty maybe just lifting the arms overhead or lifting the arms behind you. A lot of this we'll be able to pick up as we work through some of the assessments. So before I do get started, one thing which I'll be coming back to a few times and will help paint a picture of how the shoulder is moving and feeling is something called closing angle joint pain. So as we're focusing on the shoulder, the closing angle joint pain is referring to the closing angle of that particular joint. So when we assess, we'll be assessing internal rotation, how well the shoulder can do this movement. And so the closing angle will be on the front side. What we're trying to be aware of or make note of will be that's a pinching / weakening sensation. Almost like you feel like you're hitting a wall and there's nowhere else to go. There is just no space in that joint. The external rotation will be the opposite. So the closing angle will be on the back side of the shoulder. So as we're assessing this motion, if you also start to notice any sort of pinching, irregular discomfort that's not normal, that could also be indicative. So we're now going to move on to the floor, and what I'm going to do is run through these two motions and how I would assess them. So the first thing that we're going to assess will be internal rotation of the shoulder. And for this, while we do the assessment, we're trying to avoid as best as possible any form of compensation. And this will be also indicating that we've actually run out of active range of motion for this particular joint before other areas have to come along for the ride or we witness or experience compensation. So typical things that you'll kind of notice when assessing the shoulder joint will be the shoulder blade actually moving and coming along for the ride, and we want to eliminate or minimize this as best as possible. Other things may be bending of the elbow, flexing of the wrists, or even manipulating the spine. Maybe you start arching the spine, moving your head to achieve more range. This is not what we want. So setting up will involve lying on your back. You can play with either having your knees bent or legs straight. You want to set up with the elbow in line with the shoulder, not really any lower, higher, in line with a 90-degree bend in the elbow joint, and trying to keep the wrist straight, okay, whether with a fist or a hand. Then the movement is to internally rotate the shoulder. So I'm actively performing this movement, okay, and I'm trying to assess how much range I have before I start to compensate. So for me, it's about here. The minute I start to go more, I can actually feel my shoulder blade lift off the ground and actually move slightly. Okay, and this is not any more internal rotation of that joint, but just compensation. Things we can do to help this assessment is, say, take the other hand, place it on top of this shoulder. So as you begin to internally rotate, you'll start to feel most likely when that shoulder blade or shoulder might be pushing into your hand, indicating that shoulder blade is starting to move to achieve more of that range. As I mentioned, monitor compensation by maybe bending the elbow, bringing it in more to get more range. Maybe you start flexing the wrist to get more range. Maybe you start arching the back. All these little things we try to minimize. So that's for internal rotation. External rotation will be the opposite. So I'm trying to rotate my fist towards the ground, and the same applies in terms of what you're monitoring. Trying to make this as clean as possible without any compensation. Commonly what I witness with this one is once you run out of external rotation, again that shoulder blade will start to slide down, come in. You may even start to arch the back and create more of a gap in here as you perform the movement just to get a bit more range, and we don't want that. So you're really trying to assess how strict you can perform this as well. Now, you may find you only get to here before things start to compensate. You may find that things only get to here before they start to compensate. If that starts to happen, then it can already start to paint a picture on how more global movements will start to move and feel. As I mentioned earlier, rotation is the fundamental motion of your shoulder joint. What that also means is that the better you're able to rotate your shoulder joint, the more movement freedom you'll have with everything else you'll do. So generally what we see is when someone demonstrates the ability to externally rotate their shoulder very well, the ability to do this, it most likely means that when we ask that same person to try and lift the arms overhead, they're going to start to struggle the more we get them to lift the arms closer to being overhead. The same, if you don't have great internal rotation, anything that involves these arms coming from behind may demonstrate as limitations. Things like maybe doing a barbell bench press and doing dips, doing a gymnastic form exercise where you need to get these arms behind. All of this can pose as a problem. Another thing that's very important is coming back to that joint health. When you don't have amazing rotation of the shoulder joint, it will also suggest that the actual space within that joint is very limited. So imagine your shoulder being that ball and socket. We're trying to improve or assess how well it can move in that ball and socket, independent from that shoulder blade. The more movement freedom, the more open there, more space there is in that joint, the more movement freedom you'll start to have, meaning that all movements become easier. So this is the first part. How well can you rotate that shoulder? Say for someone that's doing anything overhead, whether it's pressing a bar or throwing, say serving in tennis or throwing a ball, what we would want to see is a bit more movement freedom beyond what they can do. So someone pressing a bar, I would want to see that they have at least this 90 degrees, but also a little bit more, 10 to 15 degrees extra, so that they can go beyond the demands of what they need. And this will help for things such as mitigating and reducing the risk of injury, also creating a safe and efficient work environment for that shoulder joint based on maybe what movements you're going to throw at it. And then another thing I didn't mention is whilst you are assessing rotation of that joint, you want to also be mindful of those closing angle pains. So when you are doing this assessment, did you feel any maybe pinching, tightening, or lack of space on the front side as you internally rotated, and as you externally rotated the same? Did you feel any sort of pinching, maybe bone hitting bone, tendon, ligament, something that doesn't feel particularly right? Make a note of these things. Again, this could suggest something happening below the surface which is not particularly happy. The second assessment I'm now going to run through is a shoulder CARS. So CARS standing for controlled articular rotations. Emphasis with this is going to be on improving the way we can control this movement. Articular, we're moving the joint, and rotation as the focal point of that particular joint. So rotation being the emphasis as we go through the movement. These are very important things to also assess. Now there's a couple of things we can also assess. So I'll break it down to make it as easy as possible to digest, but the first one will be the visuals, what you're seeing. So that means also either doing this in front of the mirror or recording yourself and looking back at the video. And the second means of assessment will also be sensations, which I'll come to once I've run you through the actual movement. I'm going to have my arms by the sides. Now this is going to be the working shoulder. So to begin with, I'm externally rotating the shoulder. So I'm going to turn the thumb out this way. And understanding that that rotation is external, it's going to come from the shoulder, so I made that happen from here. Now, I'm going to bring my arm across my midline, holding onto that external rotation. And then I'm gradually lifting it into my overhead position, still trying to hold on to external rotation. And then when I get into this overhead position, I am going to pause, internally rotate the shoulder. So my thumb moved the other way, But that came as best as possible all from this shoulder joint, okay? Not the wrist moving, not the elbow moving, but the shoulder. I internally rotate the joint as best as possible, and then I'm drawing a circle behind me, continuing to internally rotate, which will most likely allow me to finish with the palm facing outwards, and then I reverse this movement. So I hold on to internal rotation as best as I can. There's a point I struggle to lift up the arm behind. I rotate to bring the arm back out and around. So from the side view, bringing the arm across the midline, holding on to external rotation. When I get here, I internally rotate the shoulder, and as I send my arm back, I'm continuing to internally rotate as well. Then I rewind the movement, hold internal rotation. Once I start to hit my blocking point, just gradually and slowly rotate the shoulder joint the other way as I'm coming back into my overhead and slowly going back to the start. So as I mentioned, visuals is one way that we can assess. So what are we trying to assess are things like compensation. How well can I perform this movement without other nearby joints facilitating? And then I'm also trying to minimize that from happening. So a shoulder that maybe lacks rotation will most likely lack other movements, such as being able to lift the arm up in front, out to the side, or behind. As we go through these movements, maybe once I start to run out of the ability to lift my arms overhead, common things I'll see is bending of the elbow. We want to minimize that. Okay, you may find you can't even get all the way up here, and if you try, you start sliding the shoulder blade up a bit more, or maybe moving it down and arching through the ribs to lift the chest up a bit more. These are things we don't want, so we're trying to avoid moving through the spine, moving the head back and forth. We're trying to avoid excessive shoulder blade movement. A little bit will be fine, but we don't want the main movement to happen from the shoulder blade, but that ball and socket, as I mentioned earlier. Okay, so things such as inability to lift the arms overhead might be displayed with elbow bending, you trying to move your head forwards to get the arm overhead. As you reverse, when you start to lift the arm up, you might realize that you're struggling to hold on to rotation. So that could be compensation. You trying to come out of rotation a lot sooner. Again, this might display through you trying to slide that shoulder forwards or even trying to lean forwards. Another common thing I will see is, as you go through this, twisting of the spine, rotating of your upper body. All these things you're trying to feel out and minimize, okay? Until you build better awareness of how your body moves and feels, it is definitely worth making a video to see how your body, your shoulder joint moves, and even making a comparison from one side to the other. So another point I touched upon earlier with assessing the shoulder CARs is sensations. Sensations will indicate a lot as well the quality of that shoulder joint, not just on the surface, i.e. the muscles, but below that surface, at the capsule level, at the joint level, the connective tissues nearby it. So as you go through these CARs, what you're trying to assess is things, and this can also be a combination, but throughout the movement, maybe you start to experience a bit of weakness. Weakness maybe where there's the limitation, so overhead position could get hard, you don't feel as strong. That weakness could also be translated into maybe you feeling a lot more tightness all of a sudden. Muscle starting to burn. Commonly, once you get to that limitation and say it's up here, this just all of a sudden starts to feel like a lot of effort to move that shoulder joint in space, first when your arm is a lot lower down here, for example. Things such as when you're moving through the transitions, you might experience a bit of grinding, almost like the joints are hitting a wall. So again, commonly where the limitation happens more up here, this whole trying to internally rotate, continuing to rotate the shoulder as you send it back, could be felt as very limited. You just don't feel as much space within that joint, and things are just not rolling over themselves very smoothly, whether it's bone to tissue, etc. This one is interesting because it could also link quite closely to the closing angle joint pain I mentioned earlier. So that can be experienced almost at any point with this exercise. But as we start to come more up with the arm, we start to reduce the space in that joint more. So commonly you might feel pinching here inside here. As you lift the arm up anywhere from there to here, you could feel be pinching on the front side, which might also translate or transition to the back when you get here overhead. Those pinching sensations, or almost like you're hitting a wall type of sensations, suggest that something is happening below the surface at a joint capsule level, and this could be early signs of things we want to monitor, not allowing to get worse. This could lead to things such as shoulder impingements, frozen shoulder, and you just not feeling safe and capable to perform movements, whether it's for sport or if it's just going about your daily activity at work or training of sorts. So this is in general a means of you being able to assess, on top of what I demonstrated with the floor assessments on rotation, taking a bigger picture of how your shoulder moves overall. Now you probably have an idea that if you play a sport such as tennis, it's quite important how well you're able to lift this arm overhead for things such as the serve, how well you're maybe able to externally rotate the shoulder for the ability to take that arm behind you, almost to cock the shoulder, prepare it before you throw forwards with the arm to hit the serve. So you're probably wondering now how you can work on improving the mobility and health of this shoulder joint. What I'm going to tell you for this is that what I just gave you as a means of assessment, the shoulder CARS, the controlled articular rotation, is that first step to working on improving the mobility and health of your shoulder joint. So why do the controlled articular rotations? This is almost like the backbone to everything I do within the system. This will help over time build more awareness of the quality and ability that you can move said joints. This will also start the process of improving that health of the joint by, say, reducing inflammation around that joint and nearby tissues, reduce joint degeneration by helping maintain a healthy joint. Joint degeneration can happen through means of wear and tear, doing excessive amounts of a particular movement, sport. Maybe you have a very sedentary job, for example, where you're in a static position a lot of the time. And all of these can also lead up to things such as scar tissue in and around the joint. So by performing CARS on a daily basis, we're helping to reduce a lot of the negative impact that we have from conventional means of exercising, playing sports, and just gradually getting older and the general wear and tear that we start to experience along the way. One final thing I will leave with you is as well assessing the current state of your joint. All right, just because you have a mobile joint or you've worked on it and it's a lot better doesn't mean that it's going to stay that way. It's very important, and I always come back to doing these basic forms of assessment, such as my internal, external rotation on the floor. On a daily basis, I'm going through my glenohumeral or shoulder CARS, and I'm assessing over the long period, I mean months, not just days or weeks, but months to a year. Have I lost certain amounts of ranges over time, and why? Generally speaking, when we start to specialize in certain activities, maybe calisthenics, working on a high volume of dips, pull-ups, etc. Yes, over time, if you're not taking care of what is underneath the surface, what actually creates movement, those joints, the capsule and everything responsible, then it will gradually degenerate. So I'm always coming back to these assessments over time to see what I've lost, and I ask myself the type of questions such as, why have I lost it? Have I been doing a lot of this? This could start to paint the picture, like I said, with the calisthenics. Maybe you're doing a lot of things that put a lot of stress on this shoulder joint. So having that level of awareness over time on at what state today your joint is will help for you to kind of plan or keep a level of awareness of when maybe you need to back off with your training or start giving a bit of care for that shoulder joint. So my last thing I would like to give away for you guys is, if you actually enjoyed what I ran through today, the next step would be on how you can improve joint space. So how you can then start to improve specifically the ability to move your shoulder in all its movement abilities possible. All the movement freedom it's capable of, you want to try and bring back. So for that, check out my video where I'm running through my 5 go-to shoulder exercises, and here I will help progress the next step for helping improve what we've learned today. And as always guys, if you enjoyed today, don't forget to like, share the content, leave a feedback or any questions you may have, and I'll get back to you as soon as possible. Thank you.